Hey, I'm glad you're here to review your Medicare and You Handbook with me. I'm Mike at MedicareSavings.us. This is the official U.S. government Medicare Handbook for 2022. I've got mine in the mail. Hopefully you got yours. If you don't have one, you can request one at Medicare or on your mymedicare.gov account, or you can go to the Centers for Medicare and Medicaid offices in your local area. So first off, on page number 2, what's new and important? So there's obviously a lot of things going on with COVID-19. So the related items and services, those are covered under Medicare that for the coronavirus, like the vaccine, the diagnostic testing, the antibodies, tests, and treatment. Cognitive assessment and care plan services. Medicare covers cognitive assessment to help detect the early signs of cognitive impairment. Blood-based biomarker tests. This Medicare covers this screening test for colorectal cancer in certain cases once every 3 years. So Medicare does add on to their services for beneficiaries. Medicare.gov updates all the time, and they're making updates to Medicare.gov throughout the year to improve your online experience and to focus on making it easier to find and use the information you need. And also too, they're also directing a lot of folks to speak with their state SHIP offices or Center of Aging offices to get more information about the type of coverages and plans that are available in your area. So Medicare.gov is the online marketplace for Medicare Advantage plans. So if you have a MyMedicare.gov account, or if you're shopping your Part D drug plan, they're the administrator for Part D drug plans for the entire U.S. So it's really important if you're a Medicare beneficiary to create an online MyMedicare.gov account. Okay, so let's go to page 3. So the contents. So we've gone over what's important, but really you should start right here at what the parts of Medicare are if you're brand new to Medicare or don't quite understand it, because this will help you discern some very important decisions that you may have to make when you're either transitioning into Medicare or shopping your coverages to get the type of coverage that you want for your Medicare journey. So it's really important in the beginning as well as throughout your Medicare journey to understand the parts of Medicare, because that sometimes can seem complex, but it's actually very straightforward. Okay, so the next part is your Medicare options, and then also at a glance, original Medicare versus Medicare Advantage. And those are the two main ways to get your healthcare benefits or your Medicare benefits, is either through original Medicare A and B or Medicare Advantage. Okay, and then they have a kind of a checklist here for you. Get started with Medicare. You can either do this through the Medicare and You Handbook, or if you're online, they actually have an interactive form for you to click on to get started with Medicare. And if you need more information about that, you can go to Medicare.gov. Okay, get the most out of your Medicare. So you do want to make sure you do not only the initial health screening, but the annual free annual health screening as well when you're on Medicare, and it will tell you how to get the most out of your preventative services and other services that are available to you as a Medicare beneficiary. So some of the topics here, especially if you're new to Medicare, is signing up for Medicare. That's on page 15. So that is sometimes not a straightforward process for you if you are talking to your employer and seeing how that coordinates with Medicare A and B, but this is strictly for signing up for Medicare when you do it through either going through the Social Security Administration offices, or more conveniently is when you do it through your SSA.gov online account. You can do it, you can sign up for Medicare A and B. Okay, so section 2, find out, and I'll blow this up for you. Find out if Medicare covers your items or services for Medicare or COVID-19. And so there's actually a very easy to use what's covered app for Medicare. So if you download that app, and if you have a smartphone, you can actually type in what the type of tests you may need, or services or supplies that you may need from for your health care, and then it will tell you if it's covered or not. Or easy way is to be able to call 1-800-Medicare 365 days out of the year, and just say agent agent a few times when you hear the voice prompts. All right, and then section 3 is original Medicare, and it's on page 57, and it's going to tell you exactly how original Medicare works as the fee-for-service program that was developed in 1965, and then the first policies were were, were, were handed out in 1966. So in section 4, Medicare Advantage plans and other plans, so it breaks down Medicare Advantage plans in HMOs or PPOs, as well as other different types of Advantage plan types. So there's more Medicare Advantage plan types than there is traditional Medicare. Traditional Medicare is the federal government, and it's the fee-for-service program that you paid your taxes into all your working years for Part A, and then you elect for Part B going forward, and there is a Part B premium. So either way, if you're going Medicare Advantage or if you're going original Medicare, you still have to pay for your Part B premium to be able to get the health care benefits that you want to use Medicare for your medical services and supplies. All right, so and then section 5 is really important for the folks that chose traditional Medicare, because Medicare supplement insurance is also known as Medigap insurance, and it fills in the coverage gaps that of original Medicare A and B. So typically, if you chose traditional or original Medicare A and B as your primary health insurance, your Medicare supplement insurance, your Medigap insurance, works in tandem with that, making that coverage pretty much comprehensive nationwide coverage for you to use throughout the U.S. And so a lot of beneficiaries, about 64% in 2018, chose traditional Medicare, and about a third and a little bit more now in 2021 have chosen Medicare Advantage. And that's the landscape of either original Medicare with a supplement typically, or Medicare Advantage. And the last section for coverage is the outpatient drug coverage, known as Medicare Part D. And so Medicare drug coverage is under section 6, page 79, and it goes in depth on how outpatient drug coverage works. It's a lot different than what you're used to have on your group health insurance or your union or group coverage, to where it's typically a standalone drug plan, and Medicare is not able to negotiate pricing, so there could be some sticker shock. So make sure if you do transition into Medicare, it's not a costly mistake for you, because your medications that were higher tier 3, tier 4, tier 5 that were being covered under the group health plan will no longer be covered under the standalone Part D drug plan, the outpatient drug coverage. So make sure you do a little bit of homework before you transition, or if you don't take a whole lot of medications, then the Part D drug plan will suit you if you aren't taking very many. And then section 7 here is get help with your health and drug costs. Those are the Medicare savings plans or programs that are sometimes confused by our organization, Medicare Savings. So Medicare savings programs are federally funded, but state organized. Sometimes they work in tandem with some of the state programs like LIS, Extra Help, and those cover premiums or deductibles or cost sharing that the beneficiary cannot cover due to their limited resources. So let's go with Section 8 now, and know your rights and protect yourself from fraud. So this is a common theme on Medicare.gov, SSA.gov, and a lot of other federal websites, is that you should, it says on the very front or very top, to protect your identity and protect your login information. So make sure that you're protecting your information and making sure that you're not a victim of fraud, because the scammers are during this pandemic time and social distancing, they've been more successful than ever before, getting folks' identity through false emails, through fraudulent mail, and through you clicking onto fraudulent websites that is not a part of the government entity of Medicare or Social Security. I'll say, so get more information. So you can actually get more information at your state SHIP office, your state health insurance programs that are in your state, or or centers of aging or office of aging in your area, for more information and benefits and services that are available to you in your community. And so obviously there's a lot of Medicare speak, and that's section 10 at the very back. And you'll see this keyword or key symbols throughout this new Medicare You Handbook: compare, cost and coverages, and then the preventative services. So this is something fairly new, and then something for you to highlight as well. So I won't go through all the individual ones from here, but this is essentially what your Medicare card will look like. It will say Medicare Health Insurance. It is a health insurance based program where the providers must be accept assignment from Medicare. So there's over 1 million physicians and providers that accept assignment from Medicare, which means they accept full payment from Medicare, which means that it's the largest network, if you will, nationwide of healthcare providers, PTs, OTs, physicians, nurses, that accept assignment and payment from Medicare. And so they are the primary payer and primary health insurance for majority of the beneficiaries and retirees out there that have traditional Medicare A and B as their health insurance. And this is the card that you'll use when you go to your doctor's office, if you need to go to the hospitals. We're number 3 in the world for the most hospitals per capita for our country, or for the countries. So we have a lot of hospitals: MD Anderson, Mayo Clinic, Duke Cancer Institute, and so there's a number of hospitals, St. Jude's, that all accept Medicare as payment for your health coverage. Okay, so I'll just quickly go over your Medicare options. So original Medicare and Medicare Advantage. And so this is where you need to understand not only the parts of Medicare A and B, but then you want to understand that as well, who is paying the claims, and that gets into medical billing. And so if you want to know more about medical billing, I have an interview with an expert from Billing Buddies, Bonnie Floam, explaining medical billing, what it is to providers, how they get paid, as well as the EOBs for Medicare beneficiaries, what an EOB is, and how that is a stopgap measure for you to be a part of the process of the claim payment and see what your cost sharing may be, whether it's the deductible or co-pays, or the things that are out of pocket for you, the insured. So that is where you become a smart Medicare beneficiary, to be able to not only discern if it's a bill or not, but also to be able to know that if your coverage is able to pay those claims. And you want to know who the first payer is, who the second payer is, or who the payer is for your medical claims. So it's either the federal fee-for-service program, Original Medicare, or a private health insurance company like Aetna, United Healthcare, Cigna, Mutual of Omaha. All these smaller insurance companies that are underneath Medicare will either have HMO or PPO Medicare Advantage plans that like to bundle everything together and pay your claims. But it is more restrictive in nature. They do use prior authorization as an audit to manage your healthcare costs, and that's one of the downsides that beneficiaries do not like about the Medicare Advantage plans. There is no prior authorization for original Medicare, and it has nationwide coverage, but it can be more expensive, especially when you add a Medicare supplement or Medigap plan in addition to the Part B premium. So guys, thank you so much for watching. This has been just a very quick review and overview of your 2022 Medicare and You Handbook. If you have questions about any of the sections that I went over and you want me to do a deeper dive, please don't hesitate to tell me in the comments below what you would like to know about your Medicare and You Handbook, or about Medicare, either general or specific Medicare questions. So leave it in the comments below. Take care and God bless.